Hello everyone, this is the Theoretical Doctor and welcome back to my channel. If you're new here, welcome. This is a series on the chapter Immunity of Chapter 6 of the STPM Semester 2 Biology series. Check out the full playlist on my channel. If you want access to flashcards on this topic and other videos, do click the link below. It is available on my Pinterest and slides on this topic are available on my website. In this video, we will be continuing on autoimmune disorder and systemic lupus erythematosus, also known as SLE, whereby we will dive into the general overview of autoimmune disorder, the pathophysiology, which is how the disease occurs, presentation, symptoms, and signs, as well as the complications of SLE. Autoimmune disorder. So, an autoimmune disease occurs where components of the specific immune system start to recognize self-antigens as invaders, meaning they start attacking themselves. So this will lead to immune response against the self-antigen. So here are a few examples on the types of autoimmune diseases. Obviously there are more, but I'll just go through 5. So type 1 diabetes. It is when the antibodies act on the islet cells in the pancreas, which will lead to the destruction of the cells, and the pancreas will then lose the ability to produce insulin, rendering in the person being diabetic. Then you have Graves' disease. Graves' disease occurs when the antibody acts on the thyroid stimulating hormone, the TSH receptors. This will stimulate the receptors to cause the person to suffer from hyperthyroidism. So I just realized I made a mistake here. It's not pancreas, as it's pancreas. You only have one pancreas. Then you have SLE. So it's when autoantibodies occur against various body tissues, not only one, which will lead to antibody-antigen complexes activating the complement system, causing inflammation and damages to tissues throughout the body, such as the skin, joints, kidneys, heart, and also the lungs. Then there's myasthenia gravis. It is when the antibodies specific to the cholinergic receptors on the muscles. The binding of these antibodies to the receptors prevents the muscles from being activated by acetylcholine. This will then lead to progressive muscle weakness. And then you have pernicious anemia. So antibodies specific to intrinsic factor. Intrinsic factor is a molecule important for the absorption of vitamin B12 in the intestines. So what happens is these antibodies will block the function of the intrinsic factor, preventing the vitamin B12 from being absorbed and finally leading to vitamin B12 deficiency and megaloblastic anemia. SLE, systemic lupus erythematosus. So systemic lupus erythematosus is an inflammatory autoimmune connective tissue disease. So let's break it down from the name itself. Systemic because it affects multiple organs and systems. Lupus, which means a chronic inflammatory connective tissue disease that can affect the joints, many organs, including the skin, heart, lungs, kidneys, and the nervous system. Of course, another word for lupus is wolf, if you're a Harry Potter fan. Okay, and then erythematosus. This refers to the typical red malar rash that occurs across the face. So SLE presents with varying and non-specific symptoms. As you know, as I mentioned earlier, it can affect multiple organs and systems. So it's more common in women and Asians and usually presents in young to middle-aged adults, but sometimes it can present later in life. It often takes a relapsing remitting course, meaning it comes and goes, with flares and periods where symptoms are improved, which results in chronic inflammation. So it comes in bouts of attacks. So the result of chronic inflammation means patients with lupus often have shortened life expectancy. Cardiovascular disease and infection are the leading causes of that in people with SLE. So the antibodies involved over here are the anti-nuclear antibodies, otherwise known as ANA, and the anti-double-stranded DNA, the anti-DS DNA. So ANA is not specific to SLE because it can be presented in other conditions as well. But the anti-dsDNA is specific to SLE. Patients will usually be put on anti-inflammatory medication and immunosuppression because there is no cure. The aim here is only to reduce symptoms and to prevent the complications associated with this. So the presentation, symptoms, and signs. First, fatigue, weight loss, arthralgia, which means joint pain, and non-erosive arthritis, myalgia, meaning muscle pain, fever, photosensitive malar rash. So it's a butterfly-shaped rash across the nose and cheekbones that gets worse with sunlight. So this is an example. There's lymphadenopathy and splenomegaly. Splenomegaly means very large spleen, shortness of breath, pleuritic chest pain at the chest area, especially during inhalation, mouth ulcers, hair loss, and Raynaud's phenomenon. Actually, there is a mnemonic to remember, and the original mnemonic is SOAP Brain MD. However, this is the STPM syllabus, and there are more than one type of lupus actually, and there's another one, the discoid lupus. Since it's not in the syllabus, I'm just gonna focus on SLE over here. So I made a modification of that. It's called Mom's Soap. Mom, the M over here, refers to malar rash and common in women because mom. Then soap. S for serositis such as pleuritis and pericarditis. O for oral ulcers. A for arthritis, P for photosensitivity because it gets worse with sunlight. The pathophysiology, basically how the disease occurs, as well as the complications associated with this disease. Pathophysiology. SLE is characterized by anti-nuclear antibodies. So these antibodies attacks the proteins within the person's own cell nucleus, and this will cause the immune system to target these proteins. So the immune system is activated by these antibodies targeting proteins in the cell nucleus itself, and this will generate an inflammatory response, and inflammation in the whole body leads to symptoms of this condition. And remember, it's a relapsing remitting course. It will come and go, come in bouts of attack, and then there is chronic, meaning long-term inflammation. So complications. SLE affects many of the organs in the body. First off is cardiovascular disease, which is the leading cause of death in SLE. And then you have infection. This is mainly due to the immunosuppressants taken by the patients. Anemia of chronic disease. Since SLE also affects the bone marrow, this will cause the patient to suffer from low white blood cells, low neutrophils, and also low platelets. And then you have pericarditis. It is inflammation to the fluid-filled sac around the heart, the pericardium. Pleuritis, inflammation of the pleural lining of the lungs. So if you see the word itis, it means inflammation. Like this pericarditis, inflammation of the pericardium. Pleuritis, inflammation of the pleural cavity. And then you have interstitial lung disease caused by inflammation in the lung tissue. Lupus nephritis, so occurs due to inflammation in the kidney. Nephritis refers to the inflammation of the kidney and can progress to end-stage renal failure. And then you have venous thromboembolism, which is blood clot in the veins of the legs occurring secondary, meaning due to SLE. I know I explained all of this, but actually you just need to remember the complications, but to help you better understand, hence the explanation. If you've reached this point, thank you very much. Hit the like button if you found it helpful, as it does help in reaching out to others as well. To support my channel by pressing the subscribe button so I will know, and it gives me motivation to continue producing content like this in the future. And finally, share this video to those who might find this helpful. See you in the next one.